Welcome back. Indoor mask mandates may soon return to LA County as two ultra-contagious Omicron subvariants fuel a potential new COVID wave across California. As the BA4 and BA5 Omicron subvariants continue their rapid spread, 38 of California's 58 counties are now designated as having high COVID community transmission levels by the CDC. Those counties are home to 16 million Californians, or 42% of the state. Los Angeles has not hit the high level, but could later in July, at which point indoor masking would return. Meanwhile, just as of last Thursday, Ventura has become the first Southern California county to return to that high community transmission level. For more on that, Ventura County Health Officer Dr. Robert Levin joins the conversation. Thanks, Doctor, for being with us tonight. What triggered your entry into the high transmission category?
Good evening, Marla. I think just the fact that we were seeing cases from the previous COVID that was around, and now we're seeing 4 and 5 in our county. We're probably at 50% of the cases, maybe more, are due to 4 and 5. And these new variants escape to a greater degree than previous variants to our immunity.
And that's what we're learning here, that BA4 and BA5, the big concern with them is their ability to reinfect people who have already had Omicron, who've already had COVID. So with that said, do you have plans to reinstate the indoor mask mandate to help stop the transmission?
Well, our numbers are not significantly different than other counties in Southern California. We've entered this phase earlier than others, but my guess is that others may follow. And the line between high and low rates of COVID, as defined by the CDC, it's an arbitrary line. We're all of us transitioning from a pandemic phase to an endemic phase, and we will, in all likelihood, look back and find that we're already in the endemic phase. We can't use the definition for COVID that we use for flu. It's a different virus. People concerned about their health have multiple tools they can take advantage of to protect themselves. They've got vaccination, both oral and parenteral medications, prophylactic medications for those who are severely immunocompromised. There's, of course, social distancing, and something that all of us can do as appropriate every day is masking. And masking is and has been highly recommended in Ventura County, indoors and in public spaces, and outdoors in crowded environments. It still is.
So,
county can't force all of its people to mask any more than we could force them to vaccinate or to take Paxlovid if they become COVID positive. So for those who take advantage of the tools we have, I say they're in or near being in the endemic phase already. Our hospital numbers are relatively stable. Our ICU admissions are very low. They're at 2. And things may change. A virus, a variant, might become more pathogenic, and we'll have to adapt at that point. But for now, COVID is of lesser pathogenicity, and I think our stance on masking is appropriate to the COVID we have.
Let me get your thoughts, though, because that's such a different take than what we hear from the health director in LA County, who, you know, says that we likely, more and more likely, that was her phrase, will reinstate that indoor mask mandate once we enter the high COVID transmission category. Is it frustrating for you, the inconsistency, given that somebody from Ventura County decides to drive just a few miles to, let's say, from Thousand Oaks to Westlake Village to LA County, where then the mask mandate will likely be reinstated? Is that frustrating to you?
Not really. It's a reality. Counties have a lot of power to make these changes that are appropriate to their county, and how they interpret what's appropriate to their county. And right now, I feel that the lesser pathogenicity of the virus that we have is something that we are living with, and we're looking carefully at hospitalizations, ICU admissions, and as long as, even though this virus spreads very easily, as long as we don't see it as dangerously, unusually dangerous, returning to COVID variants previously, and how bad they were, I think we can tolerate this.
Okay. Well, for those viewers of ours who are watching from Ventura County, you heard it here that your health director will not be reinstated the indoor mask mandate. Dr. Robert Levin, thank you so much for your time tonight. Stay healthy.
You're welcome. Thank you very much. You too.